My name is Irene for the fun, and I'm going to talk about vitamin K1 treatment duration in patients with rhodopsin poisoning. Definition: rhodopsin, a long-acting vitamin K epoxide cycle antagonist, is a rodenticide encountered in intentional ingestions and as a contaminant of some synthetic cannabinoid products. Serious rhodopsin poisoning is characterized by life-threatening hemorrhage.
Hey guys, today we're going to talk about vitamin K1. I've done all the videos on vitamin K2, which is involved in the transportation of calcium out of the soft tissues, out of the arteries into the bone. But vitamin K1 is just as important for different functions, but they both work together. So vitamin K1 is a cofactor, which is a helper nutrient to make something called prothrombin. Sometimes people think, wow, I don't want to take vitamin K1 because I don't want to have a clot and die of a heart attack. But realize that vitamin K1 also has other proteins. There's many different types or subtypes of vitamin K1, kind of in a complex. There's a protein C and an S, which are anti-clotting. So it's not just about clotting, it also helps you break up clots. And vitamin K1 is really, really, really important in making bone. In fact, if you don't have any vitamin K1, it's going to be very difficult to make bone, even if you have calcium or other minerals. There are certain things that block the absorption of vitamin K1. One is if you're constipated. Number two, if you have a liver problem, a fatty liver, you have cirrhosis of the liver, you have insulin resistance, gallbladder problems because you need the bile to help you break down this fat-soluble vitamin. IBS, any type of damage within your colon. Let's say you have ileitis, which is inflammation in part of the ileum, or Crohn's, diverticulitis, can block the absorption of vitamin K1. If you had a gastric bypass, that can inhibit the absorption of vitamin K1 as well. Realize that K1 also helps make K2. It's kind of like a precursor. So your body also has microbes that make the vast majority of vitamin K2. In fact, 75% of the K2 you have is made by your own microbes. So that means if you take an antibiotic or you destroy the microbes, you're going to make a lot less K2. And what are the symptoms? You can get calcification in the arteries, you can get calcification in the joints, you can have bone loss, all sorts of things. Now the unique thing about vitamin K1, which is a fat-soluble vitamin that is different from the other fat-soluble vitamins, is that it doesn't get stored. So you actually need quite a bit. All right, so next one, vitamin K1 is very, very essential for bone. We talked about that. And also, if you're on Coumadin, okay, you can't take vitamin K1 because you have a blood thinner and you're trying to prevent strokes. Because that's going to create a problem, because where you get vitamin K1, leafy greens, all those salads that I've been recommending, right? 7 to 10 cups of salad per day, right? But if you're on a blood thinner, you're told not to consume that. But by the way, if you're on Coumadin and you can't consume a lot of leafy greens, I did put a video down below of what vegetables you should be consuming. But another option would be to talk to your doctor about this medication called Eliquis, okay? Which would allow you to consume leafy greens because it works at a different mechanism. All right, there you have it. Now you know what vitamin K1 does. So if you want more knowledge on how to create a healthy body, subscribe now and get daily notifications. Daily notifications, that sounds weird. Well, I'll just remind you on a daily basis. How about that?
Vitamin K is a coagulant and responsible for synthesis of clotting factors like 2, 7, 9 and 10. So what are the different types of vitamin K? So vitamin K1 as well as K2 are two naturally occurring forms, while K3 is the synthetic analog. First one is vitamin K1. So phylloquinone or phytonadione obtained from plant, and it is most commonly used. And vitamin K2 is menaquinone, and vitamin K3, which is the synthetic analog, is the menadione. So all these are the different types of vitamin K. So here, out of all the three, vitamin K1 is most commonly used, and the most common side effect of using vitamin K1 is flushing, and it is the drug of choice for warfarin toxicity also. And what about the sources? Vitamin K are abundantly available in green leafy vegetables and dairy products. And let us look what are the functions of vitamin K. As I already mentioned about when it take part in the coagulation process, so it is required or responsible for gamma carboxylation of various proteins which are concerned with the clotting, and it is synthesized by the intestinal flora. So vitamin K deficiency can occur after prolonged use of antibiotics, and it is responsible for the synthesis of clotting factors like 2, 7, 9 and 10, because gamma carboxylation of the glutamic acid requires post-translational modification of clotting factors 2, 7, 9 and 10, and it is dependent on the cofactor called as vitamin K. And warfarin is a vitamin K antagonist. And what about the deficiency manifestations of vitamin K? So vitamin K deficiency can cause neonatal hemorrhage with increase in the PT as well as PTT due to the deficiency of 2, 7, 9 and 10 clotting factor, but with a normal bleeding time. As neonates have sterile gut,
Welcome back. Today we'll be talking about vitamin K. We'll also mention the function, the medication involved, and the deficiency symptoms. It's very important to know that vitamin K is formed by GI bacteria. So newborns will usually have deficiency of vitamin K. Vitamin K is a cofactor for gamma glutamate carboxylase, which is important for clotting factors. And vitamin K must be activated by the enzyme epoxide reductase. The famous drug warfarin actually inhibits the enzyme epoxide reductase, thus inhibiting the activation of vitamin K. And the medications that start with PHY or Phi are actually vitamin K analogs. Deficiency of vitamin K will cause blood thinning with normal bleeding time because it doesn't affect the platelets. And excess in vitamin K will cause renal damage. And here's a small quiz for you. So what vitamins that are essential for the newborn, and what clotting factors depend on vitamin K? And here are the answers. To remember the clotting factors, I remember that 2 plus 7 equals 9, and I'll just add 10 there. Alright guys, that's everything I've got. Hopefully I made this easier for you. Thank you guys so much for watching, and I'll see you guys later.
Brodefarcalm is a highly lethal 4-hydroxycoumarin vitamin K antagonist anticoagulant poison. In recent years, it has become one of the world's most widely used pesticides. It is typically used as a rodenticide but is also used to control larger pests such as possum. Brodefarcalm has an especially long half-life in the body, which ranges to several months, requiring prolonged treatment with antidote or vitamin K for both human and pet poisonings. Chemical synthesis: Brodefarcalm is a derivative of the 4-hydroxycoumarin group. compound 1 is the starting ester needed to synthesize brodifacoum. To obtain this starting compound, a simple Whitted condensation of ethyl chloroacetate with 4 unregistered trademark bromobiphenyl carboxyldehyde was accomplished. Compound 1 was transformed into 2 by consecutive hydrolysis, halogenation to form an acid chloride, and then reacted with the required lithium anion. This was done using KOH and AO for hydrolysis, and then adding SOCl2 for chlorination to form the acid chloride, which reacted with the addition of lithium anion. Compound 2 was then transformed using organocopper chemistry to yield compound 3 with good regioselectivity of about 98%. Typically a Friedel-Crafts type cyclization would be utilized to obtain the 2-ring system portion of compound 4, but there were issues of low yield. Instead, trifluoromethanesulfonic acid and dibenzene catalyzed the cyclization in good yield. The ketone was then reduced with sodium borohydride yielding a benzyl alcohol. Condensation with 4-hydroxycoumarin under HCl yielded compound 5, brodifacoum. Toxicology: brodifacoum is a 4-hydroxycoumarin anticoagulant, with a similar mode of action to its historical predecessors decameral and warfarin. However, due to very high potency and long duration of action, it is characterized as a second-generation, or superiferain anticoagulant. Brodifacoum inhibits the enzyme vitamin K oxide reductase. This enzyme is needed for the reconstitution of the vitamin K in its cycle from vitamin K oxide, and so brodifacoum steadily decreases the level of active vitamin K in the blood. Vitamin K is required for the synthesis of important substances including prothrombin, which is involved in blood clotting. This disruption becomes increasingly severe until the blood effectively loses any ability to clot. In addition, brodifacoum increases permeability of blood capillaries. The blood plasma and blood itself begins to leak from the smallest blood vessels. A poisoned animal will suffer progressively worsening internal bleeding, leading to shock, loss of consciousness, and eventually death. Brodifacoum is highly lethal to mammals and birds, and extremely lethal to fish. It is a highly cumulative poison, due to its high lipophilicity and extremely slow elimination. Following are acute LD50 values for a variety of animals. Given these extremely high toxicities in various mammals, brodifacoum is classified as extremely toxic LD50.
Application in nursing. The nursing team must have an agile response when identifying patients poisoned by brodifacoum. The response time will be vital for the treatment. Treatment with vitamin K1 must be administered in a period of 16 to 64 days until the patient's blood brodifacoum concentration in less than 10 mg per milliliter. Pros and cons. Vitamin K1 treatment. Pros: easy to treat, fast recovery, easy access to medicine, cheap medicine, no risk of death if treated early. Cons: long hospital stay, continuous monitoring of the level of brodifacoum in the blood, hospital infection risk. Monitoring this therapy is difficult. ISO applied in Ecuador. Since brodifacoum is an active component in rodenticide, the greatest number of poisoning cases are found in rural areas, which is why hospitals, subcenters, and health houses must have a good supply of vitamin K1 to be able to treat poisoning cases. It is important that the health personnel have the proper training to be able to identify the case as soon as possible and thus be able to administer to treatment in an assertive way. Conclusion: since vitamin K1 treatment for bradyphasum poisoning is easy to administer, it is important that rural hospital, health homes, and hospital centers greater numbers of poisoning cases have all the information and training to effectively identify poisoning patients. The nursing areas must have all the response material to ensure the life of the patient, as well as a list of all local rodenticides that have bradyphasum as an active component. Thank you.